The number of people infected by coronavirus around the world keeps rising. As at February 11th, over 108 million cases have been reported globally, with over 2.3 million deaths, and in Nigeria over 143,000 cases, leading to the death of 1,710 persons have also been recorded. This explains why countries around the world have intensified efforts to procure vaccines in order to curb the spread of the disease. But Nigeria's hope of getting the Pfizer vaccine was dashed when the COVAX vaccine network announced that the country will not benefit from its first shipment to Africa. Officials of the WHO and the Ministry of Health have been explaining the exclusion.
Nigeria was among the 51 countries globally that were deemed ready, and the decision was just because of the supply. If you look at 1.2 million doses of Pfizer vaccine that were pledged as available, if you divide by 51 countries, you can see what type of amount Nigeria would have gotten, even if it were considered.
Nigeria is currently expecting 16 million doses of the AstraZeneca vaccine. Another over 42 million doses of 3 other vaccines are also expected through the African Union. This brings the total number of vaccines expected by the government to over 58 million doses. But the capacity to preserve these vaccines in their unique temperature requirement could be a challenge, even though the government insists it is not.
The vaccines that we know, meanwhile, require 3 types of storage. There is the type that requires an ultra-deep cold chain, ultra-deep freezer storage, minus 80 degrees. That's extremely cold. And that is the Pfizer. You have probably heard also of the Moderna. That one requires minus 20 degrees. That's like a regular deep freezer you have in your home. But the minus 80 is an extreme freezer. Not many countries even have that. But we have some of them in Lagos and Abuja. That's why we can take up to 400,000.
There are only 4 ultra-cold chain structures in Nigeria, spread across 3 cities. These are Lagos, Bauchi and Abuja. According to official sources, these facilities can only store over 400,000 doses of vaccines that requires minus 80 or even minus 60 degree temperature. While attention is fixed on setting up primary storage facilities, it is also important that the government pays attention to the logistics for moving these vaccines to the field while maintaining the same required temperature for them to remain potent.